the public health officials and government. Thank you very much.
Thank you so much, Dr. John. Now we'll go on to the questions that we have. Received. I will start with the question that came from Tina, and Tina is from CCTV. She asks two questions. The first one is that there are reports that the peak of the outbreak in Africa is still to come, and it's expected in 3 to 4 weeks' time. What do you think about this? And related to that first question is another one that says, what is the Africa CDC's forecast of the pandemic situation in Africa?
Very good question from from Tina. We've said all along that the Africa was witnessing the morning of the pandemic, and we will peak. And I can't actually say if it will be in 2 weeks or 1 week or less, because many factors will determine that, especially given that Africa is not a country, but a continent. So you see countries peaking at different levels. So we will peak. There should be no doubt about that. When we started this press conference early on, exactly on February 14, only Egypt had reported a case. And today we are witnessing a situation that nearly all countries on the continent, 49 of them, have reported cases with about 6,000 cases already. So it's a matter of time before these infections seed into the community, and then you begin to see an outburst of infections there. So I think let's keep that in mind. Secondly, what do we project? We are in some countries, and again, keep in mind that Africa is not a country. It's very difficult to make projections across the entire continent. It's easy to do that in Italy, United States, because you have enough assumptions to put together that are homogeneous and can inform you to make your projections. But the situation in Africa is very different. However, we project that by the end of April, you begin to see countries cross the 10,000 mark infections. I think that is important for planning purposes and also for the response purposes there. So that's what I can tell you with respect to that. The second question was?
All right. The second question from Tina was, we know from social media that the Chinese government donated 10,000 lab kits to the African Union, and that there are other donations coming from China. So she wants to know if we think that these donations are helpful for the Africa CDC, and also where will they be used? So
let me just clarify that all donations for geared towards Africa are very important. We are dealing with a global crisis that requires global action and global solidarity. Unfortunately, the countries that used to supply us with these commodities to fight outbreaks are also challenged. So any donations in terms of commodities and otherwise are extremely valuable. With respect to the diagnostic kits, I think up to present, China has donated about 12,000 tests to support our initiative, and we have in turn distributed those to member states. So I think that is always welcome. The Jack Ma Foundation and the Prime Minister of Ethiopia's leadership initiative was highly welcome. And as we discussed last time, each country received about 20,000 tests. And that has given us a lot of time to support countries and while looking for additional tests to continue to scale this up. Remember, the centrality of controlling any outbreak is to test people, isolate them, and trace their contacts there. So we really need to scale up testing on the continent. Unfortunately, the supply chain for that is limited.
All right. We move over now to questions coming from our Blue Jeans link. And this one is from Giulia Paravicini of Reuters. And the question is, are there centralized efforts to get more ventilators to Africa? And are there enough medical staff to use them? Then there is a second part to that question. Is the Africa CDC collecting data on ventilators and ICUs across the continent?
Is limited.
Then she clarifies to say, are there enough trained medical staff who know how to use the ventilators?
Yes. Let me start with the training piece. As we discussed with you over the previous press conferences, we have a very extensive training program on case management, where we are we're using online devices to train clinicians on a variety of aspects related to the care and management of patients infected with COVID-19, including use of ventilators and ICU units. We are in the process of finalizing a comprehensive list of things that will be required to support the entire spectrum of the response. That is from masks to gloves to diagnostic tests and ICU and oxygen support systems that the Africa CDC and African Union will be procuring centrally. That way we can support countries in a more centralized and organized way. So that is being taken care of. Of course, it's hard to tell you exactly what each country has, and we are doing an inventory of that. There's a whole technical working group that is focused on documenting, generating information on the ICU's needs in each country.
Thank you so much. I'm just getting a reminder that there are people still with their microphones on, and there's a plea, please can you switch off your microphones? Colleagues, kindly switch off your microphones because it's interfering with the reception of other colleagues. We will now take a question from, let me just go back up. So this one is from Cara N, and she is with Associated Press. She says, following on the good question from Reuters, which African countries are top priority to receive such equipment? How do you decide who gets what and when? And I think here she's referring to the equipment from China.
Yes. Based on the information I just shared with you about countries that have crossed the 100 confirmed cases mark, that is an indicator to you. That tells you that in the coming weeks, you see an extensive expansion of that. Countries, have already started approaching us, like Cameroon just reached out yesterday, Cote d'Ivoire, Burkina Faso, saying, look, we need tents out there to use to triage our patients because they are running out of hospital beds already. So using the level of infection already in the country will be an indicator of how to support it. It doesn't make sense to take these respirators or ICU units to countries that are having 1 or 2 cases there. So I think tracking carefully the projections and the rise in number of cases per country, as we did in this press briefing, will be a good indicator to objectively decide where to focus our help. All of this might change in the next 2 weeks, but at least for now, that will be a key parameter to gauge where our support should go.
Thank you. We have a question coming in from Sonia Beard, and she's working with the African Exponent. And the question is, why are numbers skyrocketing? Just give me a second. I've had a response there. I need to go back to Sonia's question. All right. Sonia is asking, why are the numbers skyrocketing in South Africa? And what can be done to suppress the surge?
So the numbers are skyrocketing in South Africa because, remember, South Africa was one of the very first countries with Egypt and Nigeria to report cases or to witness cases. So, and again, we know that this is a very, very fast replicating virus. If you look at the United States by comparison, just over the last week or so, their numbers have quadrupled. Okay, very, very, it's almost like an explosion. As we said earlier, in previous press conferences that this is a virus that has a replicative factor of 2.3, which means every individual can easily spread it to 2 people, and it expands exponentially. So I think that's what we are seeing in South Africa. Now, what can be done? South Africa, as we all know, is in lockdown mode now for the next, I believe, 2 weeks. As I said earlier, this is a time for the country, South Africa, to intensify the ability to detect people, isolate them, and find their contacts and monitor them. I think that is what you do within these 2 weeks of lockdown. And I'm very pleased that South Africa is deploying all kinds of scenarios, including mobile laboratories, to move from door to door to test people and identify those that are infected and isolate them. That's the way to go. And I'm positive that that effort will yield fruits. Again, this requires the extensive cooperation and collaboration of the community. I cannot overemphasize the need for the community to cooperate in this important exercise.
Thank you. Next up, we have April Zhu, and April is working with the New Humanitarian. And the question is, has Africa CDC considered putting in orders of ventilators and other ICU equipment from manufacturers that are currently overwhelmed with fulfilling orders from governments in North America and Europe? And I think the second part of that is really a suggestion, where she says essentially to set aside equipment orders for African countries. Has Africa CDC considered this?
Yes, that's what I said. We have just finalized an inventory list, and we'll be working. Excuse me. We'll be working on that aggressively, so that that list is we move to the procurement phase.
All right. Then Neil Monshi of the Financial Times has 3 questions. The first one is, given the struggle developed countries are having ramping up their ventilator/ICU capacity, what will less developed African countries be able to do? I think let's take them one by one.
Yeah, that's a challenge that we've acknowledged from the onset. That's why initially our strategy was that of containment. But as we've moved, we are beginning to move more and more towards mitigation. That remains a huge challenge. We are considering all options, including working with just this week we did an inventory of companies in Africa that we can approach and begin to explore if they can do local manufacturing. That is repurposing some of the things that they are doing to support that kind of local manufacturing. So I acknowledge that this is a big challenge, and if many Western countries are challenged with that, you can imagine that it will even be an extraordinary challenge for the continent.
All right, the second part of the question is, if African countries are not able to increase their ventilator ICU capacity, what does the Africa CDC think will happen? Will there be more deaths? That's the question.
Yeah, definitely. There will be more deaths, but we hope we don't get to that. As we presented earlier, there are currently about 221 deaths. And that number, of course, will increase as the number of infections do increase. And if we don't have the appropriate support, then you expect that there will be an increased number of deaths for the lack of the appropriate respiratory support systems. And this is where I've made the point earlier that this is a global crisis that requires global solidarity. It cannot be that only certain countries in the north who have the ability to have these devices save lives. I mean, all lives are important in this. I fully understand the need for everybody to protect their citizens, but this is a global challenge that we all have, and it requires global solidarity and global action.
Then the third part of the question is, does Africa CDC have a sense of why there seems to be far fewer cases in Africa compared to other regions, and even taking into account a lag?
Even taking into account?
A lag, delay.
Yeah, so I don't think our cases are far behind. I mean, we have conducted some basic modeling to compare where we are after 40 days with respect to where Europe was at the same time period. And we are very, very close. Our numbers are mirroring that. The most important thing to keep in mind is that the virus will definitely find itself into certain vulnerable communities and seed itself there, and that's where you see explosion begin to happen. So I think gradually we are getting there. I mean, if you compare the numbers last week with this week, there's a sharp increase in the number of cases already. So it's a question of time before you begin to see large numbers occurring across multiple countries.
Okay, thank you. I'm just tracking to more questions because there are notices coming at the bottom which are interfering with the lineup of the questions. I'll just close that. And then go back up. All right. Now we are on to Julia Paravicini again. All right, she was commenting about the sound quality, which I'm made to understand is now okay. Then let us move on to the next question. Alexandra MH. Alexandra doesn't give the institution, but they asked the question, can the opening statement be sent to us by email after this briefing? And that they couldn't hear it. We will do that, Alexandra. Please kindly send us your email address so that we can forward it to you. Then we have April Zhu. I think we've had a question from her before, but she's asking the question. I had sent in a question through the designated WhatsApp number, and it is about serology. Let me just find the question again. All right, I'll come back to April. Let me go on to guest. Is Africa looking at research solutions towards finding its own vaccines to cure the pandemic, instead of always looking up to the West to come up with vaccine solutions? And this is from Della Russell of the Daily Graphic in Ghana.
Yes. Excuse me. As far as I know, there are over 30 candidate vaccines undergoing trial now in the world. And on the continent of Africa, there's definitely groups that are looking into vaccines testing, and it requires a coordinated effort. I mean, as we speak, we know that the only group in Africa that produces vaccines is the Institut Pasteur in Senegal, and as far as I know, they are not focusing on that for now. But the Coalition for Epidemic Preparedness and Innovation, CEPI, it has a variety of vaccine candidates that they are pushing through there. I think that regardless of who is producing it, I think we shouldn't expect a vaccine within the next 12 months. That is the unfortunate situation.
All right. Now we come back to April's question, and she says that what is Africa CDC's stance on the use of serology tests for COVID-19 diagnosis? And does Africa CDC have a say in whether or not African countries will be able to use the rapid antibody kit currently being developed by Mologic and Institut Pasteur de Dakar?
Yes, very good question. Africa CDC will be producing guidance, a guidance document on how to use the serologic test for COVID work in the next coming days, actually. There's a team, a group of experts working on that aggressively, and you will see that we'll share that information with you, or that guidance document with you very, very soon. There's a place for serology in the COVID testing. We all know what serology does. It tells you that somebody has been exposed to the virus. It doesn't tell you that they are currently exposed to it. But there are other serologic assays like assays based on, antigen tests that can actually be very useful in our settings there. We are also looking at a combination of serology and molecular assays like the polymerase chain reaction, PCR test, to use that in combination. Maybe use serology in some triage situation of individuals with symptoms, and then do PCR testing if we cannot resolve that. We are working on that aggressively, and hopefully by the end of next week, that information should be out. So yes, Africa CDC has a strong position, or will be having a strong position on the use of serology for COVID testing in the continent.
All right. Then Ellen Araya is asking the question, can you speak more about the situation in the Horn of Africa?
The situation in the Horn of Africa is, is what we know, which we have presented all the time. I mean, I think besides, if you look at Horn of Africa very broadly, that is Ethiopia, Somalia, Eritrea, and even Sudan. I mean, I will look at that from the Sudan, right? See, most countries have reported cases there. The only country that, to the best of my recollection, has not reported a case is South Sudan. Okay, and I think that is Somalia has reported, and of course Ethiopia has reported cases, and so I think we continue to watch that space very, very carefully, and as to whether Sudan will have it or not, as I said, all countries in Africa should work with the assumption that the virus will be present in every member state. It's a question of time.
All right. Then Cara Anna says, have you begun to see clusters of flu-like illnesses in Africa? If so, where? No,
we have ongoing surveillance programs that are looking into that. They call it influenza-like illnesses surveillance program, and we have not seen that. I mean, and that's a very good question, because that will give you an indication as to whether we are missing some of the cases, and the cases are ending up into those settings there. So yes, it's something that we have an eye on, but we have not seen those outbursts in communities.
Thank you. Alexandra Meyer Hodal of the German press agency, the DPA, says that you said you were pleased with the South African lockdown because it allows authorities to test people, identifying those infected and isolating them. Does this mean you would recommend that all African countries with quickly increasing numbers should also implement lockdowns? And if so, what would be the threshold of cases you would recommend for a lockdown to be implemented? Yeah,
that's a very good question indeed, because we have issued guidance already, and we'll be happy to share with you all that really categorizes and describe in a stepwise fashion as to what can be done or should be done at every level, including from a very basic level of you don't have cases. You have just a few imported cases there. You are beginning to see community transmission, person-to-person transmission in the community, and you begin to see widespread transmission. I think that those guidelines, we issued them a long time ago, and we really urge countries to base the actions on those guidelines, which were all collectively endorsed by the ministers of health when we summoned them here on the February 22nd. So there are very specific guidelines that anyone can use to determine their situation.
All right. I'm trying to see if we have any more questions that are coming in. Colleagues who are joining us online, if there's a question that I've missed, please kindly type it in so that we can go over it. If there are any questions that have been missed from this lineup, please can you type it in so that we can put it forward to the director. believe that we've covered all the questions. I'm not seeing anything else that's coming through. I can see a number of colleagues online. If your question has not been answered, please can you quickly write it down? I can see a colleague who's speaking. Kindly please write your question down if you still have questions to ask.
No, you can hear him, right?
I cannot hear him. Can you put up the volume so that I can hear what he's saying? All right. Okay. Sorry, colleague online. Can you start again? Now we can hear you.
How can you implement social distancing in a crowded setting where access to water is a problem?
You got that?
Yes.
Thank you.
So that is a very important question, and a question that, as you all know, we collectively, not just the public health experts, have been debating over the last 2 weeks or even more. And first of all, let's distinguish the process from the facts. The fact is that social distancing is a proven method for controlling this kind of pandemics or outbreaks. I think let's get that fact very, very right. Now, the question is the process. How do you do that in communities that are challenged? I mean, and that is everybody's fear and concern, that we are faced with a balance between doing what is known to produce effective public health outcomes and then the challenge of implementing that. I don't think anyone has the magic bullet, but my submission is that you need the community needs to be educated very, very well. No, education is really not the word, but community engagement is key here. That community leaders should be mobilized as much as possible. Community champions must be mobilized so that we reduce the harm as much as possible and effect of what social distancing can actually have in the communities there. But you need champions from the community, you need leaders from the community, religious leaders, to really make sure that the population understand that it is one of the most effective tools, that if we have to win the war against COVID-19 without vaccines and without any proven treatment, then we have to only use proven methods that have been, and it requires everybody's cooperation there. That's all I can say at this point.
All right. There is something coming from Della Russell. I think she's coming back for a second time. And she's asking whether you would recommend a similar approach to be adopted, that has been adopted by South Africa for other member states on the continent.
I believe that my general approach would be, don't lock down the whole country. You lock down as cities or areas that are witnessing extensive community transmission, so that, the effect is minimized. What I call social harm is minimized. But if the infection is spreading across the entire country, then you have no choice than to do that. But again, the central ingredients to this is communicate and build the right partnership with the communities. Create champions from the communities so that they understand the benefit of what is going to happen and the risk of not doing it or not cooperating with the authorities there. That is more important to me at this point. So in summary, it will be, it's not necessary to do lockdown in the entire country if transmission is not happening outside of certain areas. And if you have to do it in areas that transmission, it's a welcome tool to do it in areas that transmission is becoming extensive, but engage the community ahead of time.
All right, then we have a question from Yusra. Are African scientists involved in any of the 30 trials that you've mentioned before? And would there be plans to conduct COVID-19 phase 1B or 2 in Africa?
Yes, there are definitely Africans that are involved in these trials, whether they are in Africa or outside of Africa. There are Africans involved. I know for CEPI, for example, the Coalition for Epidemic Preparedness Innovation has many Africans working in there, and there are many universities that involve Africans. I have no doubt that there will be phase 1 and 2 trials on the continent, and especially those countries that have already seen extensive COVID cases like Algeria, Morocco, South Africa, and Egypt. So I'm very sure that there will be that those are the right places to do to consider doing trials.
All right, and we have a request from Manshi. We've dealt with Manshi before, but he said that he couldn't quite hear your question, your answer to his question, because there was audio interference. And he says, as it stands right now, given ICU and ventilator capacity, do you expect a higher mortality rate for the virus in Africa?
So first, yes, a repeat. First of all, let's look at it's all about projections and our numbers. What is it that we have that might play in our favor? And I use the word may or might play in our favor is the youthfulness of our population. We all have seen data in China and Italy and others that the rate of mortality increases significantly with age. And if you know that more than 70% of our population is less than 30 years, you could begin to factor that into the projection as to how mortality will happen or will play out on the continent. They haven't said that. I don't want to send a mixed message that the young people are not vulnerable. The young people will be infected. You are human beings. But what we have seen in the data is that the mortality is less at that lower age group. However, we know that in the United States, we begin to see a lot of young people in their 30s and 40s being hospitalized, means they require that. We also don't know what our own situation will play out in terms of the effect of malnutrition, the effect of comorbidities like HIV, TB, and malaria. I say that to say that is to do those projections, we need to factor all of this into it, i.e. the age, i.e. the comorbidities that we have on the continent to be able to give you a realistic number. If we have the large numbers there, of course, we will be challenged with, even if we have 10% of, say, 100,000 cases, that it will be a challenge for the continent because the continent doesn't naturally have those incubators or ICU units lying around.
All right, so this one is coming from Sarah Jerving, and she's with DEVEX. Which African countries are participating in the WHO's Solidarity Trial examining the effectiveness of drugs? And are there patients currently enrolled in the trial on the African continent?
That we are following that closely, but I cannot for now give. We have that inventory of countries that are enrolled in it. We're supportive of that and signatory to that, but I don't have the list of countries in front of me for now. And I will prepare that answer for next Thursday.
Okay, so Sarah, please join us next week, Thursday, for the director's comment on your question. And then this one just is called User, and their question is, have you had any response to the appeal for international help?
There's been a lot of engagement at multiple layers. I mean, we all know that last week, the Bureau of Head of States for Africa, that is President Ramaphosa, President Sisi of Egypt, President Keita of Mali, President Kenyatta of Kenya, all had a conference call to discuss the situation, and they established a COVID fund. And they immediately pledged 12.5 million, which will go into the fund. I think the appeal is out there. The fund has been created. There's an appeal for multiple partnerships, including philanthropists, the businesses in Africa and across the world. all I can say is that we've seen a lot of goodwill expressed to supporting Africa from multiple bilateral and multilateral partners there. But it still has to be, we still have to see that translate into concrete action.
All right. Lillian Calvillo says, what do you see as the fate of maternal health services and other essential health post-COVID-19 pandemic? And also, do you see a possibility of neglecting and or forgetting other healthcare services while offering response to COVID-19? And this is Lillian Calvillo from Impact Hub Media in Kenya.
That's a very critical question. And what we are also doing very carefully is putting an eye on the third arm of our, or the third pillar of our strategy, which is preventing harm. And preventing harm is speaks to some of those programs that we know. We all know that, before I go to the maternal child health, we know that for HIV, TB, and malaria, they all collectively kill about 1 million and above people on the continent. And our greatest fear is that those programs should not be handicapped and challenged. Otherwise, where it's fighting for COVID, you may completely undermine extremely important programs, including maternal child health programs. So it's something that we have to continue to put on our radar and advocate for. And the time to advocate for those programs is not when COVID is over, is now. So that we look at it from a very holistic point of view and say, well, COVID is disruptive, is challenging our health systems, but we still have HIV, malaria, and tuberculosis, and they're all Africans dying from it every year. So we have a call actually with UNAIDS today to discuss exactly how COVID might impact HIV programs across the world, and of course, including Africa.
And this is the last of the questions that I have now. And it's Ellen Araya. I think she's asked another question previously. But this question is, are there unique mutations of the virus in Africa or a variation on the symptoms?
For now, remember we have just about 220 deaths, but we are studying all of those very carefully. Every week, as a matter of fact, we pull in a country from within Africa to present their situation to the task force so that we can actually look at the clinical spectrum and who is dying and dying of what. With respect to mutations, that we have through the Africa Task Force for Coronavirus Preparedness and Response, we have a group, a subunit of that is subtyping viruses, which means they are sequencing the viruses to look for exactly the mutations. But for now, I cannot speak to any unique mutations that we have seen on the continent. I remember that we had, through that partnership, the Task Force for Coronavirus for Africa, when the first cases occurred in Nigeria, they were sequenced immediately and the sequences were shared. And that is the behavior or attitude that we want the continent to do. We have the capacity and capabilities on the continent to do that. Through this network, we'll continue to sequence viruses and understand the behavior of the viruses over time with respect to changes in mutation.
All right. These ones are back for more clarification, and I have two. The first one is Della Russell of the Daily Graphic in Ghana, and she says her question on whether African countries could adopt a similar approach to South Africa was more focused on mobile laboratories. Yes,
and once you have let's again look at the process. Once you lock down a city like Ghana, I mean, your ability to, the benefit of that lockdown is in your ability to quickly test people and isolate those who will who test positive and also find their contacts there. So it requires that you have mobile laboratories. If you do not have mobile laboratories, then you have to have a good specimen transfer system where if you do the door-to-door testing, you can collect the specimen, put them in the appropriate media and take it to the reference lab and test. But the importance of the turnaround time has to be highlighted, which means you don't delay the results, because people are anxious, they want to know the results, and you too, you are also anxious because you want to know if that individual that you tested was positive so that you can take the appropriate measures. So what South Africa is doing is supplementing the testing process with introducing mobile laboratories there. Whether that is actually applicable to all countries or not is not the major question. The major question is, can you set up a system that you can test quickly and return the results and use the results for action?
All right. The other repeat question has come through on our WhatsApp, and I believe it's coming from Julia Paravicini of Reuters. And the question was, are there centralized efforts to get more ventilators to Africa? And are there enough trained medical staff to use them? And then secondly, is the Africa CDC collecting data on ventilators and ICUs across the continent?
Yes, I think, I thought I answered that question.
Yes, you did.
Yes,
she did not.
She did not. Okay, yes, Africa CDC is has already conducted an inventory. It's a process of completing that, but we have also used what we have to centralize our ability to procure. What we are looking for now is just the ability to be funded appropriately so that we can place those orders soon. So we know the numbers that we need to possibly support countries. We also have conducted a very quick desk review of that. In terms of training, as I indicated earlier, we have an online training that we've actually trained more than 300 physicians on the entire spectrum of case management, including use of ICU and incubators there. So we're doing that as a network across the continent.
All right. I think this will be our last question because I don't see any more coming in. And this one is coming from Della Russell again. Della Russell of the Daily Graphic in Ghana, thank you for your questions. And the question is, what is the AU's position on nationals who tested positive for COVID-19 in other countries? Can such persons be repatriated to their home countries for treatment?
So, you mean in Africa?
She says, the position on nationals who tested positive for COVID-19 in other countries.
Yes.
And can those people be repatriated back to their home countries?
My position, and I can speak on behalf of Africa CDC, is that if you test positive in a country, you should seek care in that country. That is, that is simple. I mean, if you are positive and you are sick, it means you require care. I mean, that is just clear. We should also note that about 80% of individuals that will test positive will have very mild symptoms. And as we know in the West, some of those are just being managed at home. And then you have 10% that will develop some form of severe symptoms that will require that you go visit with a doctor. And then about 5% or so will really require the ICU care that we are referring to. So it depends on where you are. So if me, John, is in a country X and I'm tested positive, it's not a death sentence. So you can determine with your physician what level you are. If you have mild symptoms, then you can be managed adequately. But the key thing is the patient care, that should get the appropriate care using what is available in that country as much as possible.
Thank you very much to Dr. John, and thank you to the colleagues who have been joining us on our live stream, as well as on our Blue Jeans connection. We'd like to apologize for the rough start to this press briefing, but we do believe that for those people who did not hear the initial comments, that the director has had the chance to repeat some questions and go over those issues again. We will be joining you again next week on Thursday at the same time at 11 a.m. Please, if you do have questions that you want to forward to us before then, kindly use the WhatsApp numbers that will be on the press releases to be sent out to you. I think that will make it much smoother. But in any case, thank you so much for having joined us, and thank you for your patience. We look forward to your continued cooperation as we continue to inform the continent about COVID-19. Thank you, Dr. John, and thank you to colleagues.